All right. Hello, everyone. I would like to extend a warm welcome to Dr. Schneider, who happens to be a dear friend of mine. Our friendship goes back a couple of years to the time when I initially approached him seeking mentorship for a case study through a program called Clinical Mirror. I was truly enthralled by his extensive knowledge and meticulous patient observations, which allowed him to identify specific issues that could aid their functional recovery. At present, Dr. Schneider is dedicated serving at an esteemed private clinic called Kinetic Chain in Denver, Colorado. And without further ado, I will hand over my mic to my friend.
Hey team, you can call me Gary.
Well, Gary, I do have a couple of questions that I would like to ask that might benefit our audiences right here. Would you kindly provide an introduction of yourself and share the type of therapy setting in which you currently work in?
Sure. So, like Hoan mentioned, my name is Gary Schneider. I am a licensed physical therapist. I graduated from physical therapy school where I earned my doctor of physical therapy in 2018, and then I moved around the country a little bit, and now I am in Denver, Colorado. I sat for and passed the orthopedic clinical specialist exam. That was in 2021, so 2 years ago. And now I work at a small boutique cash pay clinic in Denver, where we specifically focus on and specialize in treating active adults between the age of 30 and 50, people who are super passionate about their activities. So, a lot of runners, a lot of marathon runners, a lot of high level skiers, CrossFit athletes, competitive weightlifters, so on and so forth. So, that's kind of my short and sweet who I am professionally.
That's great. Thank you. Thank you for sharing. So you just mentioned about OCS. It's called Orthopedic Clinical Specialist, right? Could you please provide some more detailed information about your specialization as a physical therapist, specifically the patient population you treat and the benefits associated with being a specialist in your field?
Yeah. So the main benefits that I appreciate is that I am very familiar with the updated research and information that the governing body of board certified specialists want me to be familiar with. And so that comes to play in the clinic when I am treating a patient and I can reassure them that we're doing everything research driven and proven to affect their situation. So obviously, if it's really, really helping the patient, then no further explanation needed. But commonly, there'll be complicated cases where people aren't making as much progress as they would like to, and I am able to confidently reassure them that we're doing exactly what the book calls for, and specializing it, individualizing it specifically to their situation. So it gives me a blanket of confidence, which I can then demonstrate and or transpire over to the patient themselves. Does that make sense?
Yes, absolutely. So with that said, I guess being a specialist gives you confidence that you are providing evidence to practice.
Yeah, at least that's what I see as the largest benefit.
So you also mentioned that you were working in a private clinic who most of the patient population is a sports related injury. Do they or the clinic itself require people with OCS because they are dealing with musculoskeletal problems?
No, no requirement of OCS. In fact, the owner and my boss, the guy who started the company, does not have his OCS, so that is not a requirement. But it does look a little bit better on a resume. But unless you're familiar with the uh, protocols to actually pass the OCS exam, then it doesn't look any more sexy than any other letters. So my boss puts MTC, manual therapy certification, even though that's just a couple weekends of course, and CSCS, which is a different test, a strength and conditioning certification, and different levels of studying. But the clientele and honestly, a lot of the medical field don't even know the difference.
So moving forward with the next question, what sparked your interest in that particular specialty? Could you elaborate on the steps and additional training you pursued to become an OCS certified therapist? It would be helpful to understand the educational and professional requirements involved in specializing in this area.
Yeah, so coming out of school, I knew that I felt very driven to be the best physical therapist that I could be, and I wanted to make sure that I was being uh dr- I wanted to make sure that I was learning and improving in the ways that the really smart people wanted me to learn and improve. The really smart people being the people who do the research and are able to decide how we should be practicing, what best practice is. And so I made the decision to prepare for and study for the very challenging test that is the OCS. And so that's why I did it, because I wanted to make sure that I was practicing in a way that wasn't just good to my standards and my coworkers' standards, but actually to the standards of the governing bodies. And the preparation for me looked like basically two multi-week, actually basically over a year of studying via multiple courses. So I took a series of four in-depth uh, online plus weekend courses throughout a year, and then I took like a 16-week exam prep course in order to prepare myself, and that involved hundreds of hours of studying. I mean, it was brutal in a good way.
That's amazing. Did you have to meet like a certain number of patient care in order to apply for that test?
Yeah, in order to apply for the test, you have to have documented work for at least I think it's 200 hours. I'd have to go look back and look at the number. It ends up being at least 1 year of practice. You can't really apply before a year. And I actually talked to a lady about this when I was at the CSM, the Combined Sections meeting, which is the national physical therapy meeting, and the lady said they don't recommend applying earlier than a year because it just is too hard. I mean, you just don't have the experience, you don't have the time to study, and so they say just wait. And so yeah, I applied after 2 years of practice.
So I guess 2 years of practicing specifically with orthopedic population, right?
Correct.
And how would you prove the documentation that you had devoted,
It
to
was a pretty loose system. I wrote down the number of hours I had worked per week, per month, per year, and then had my supervisor sign off on it.
Thank you. All right. So last and final question. Drawing from your experience, what recommendations do you have for new graduates or early career physical therapists who aspire to become specialized therapists? What steps or strategies can you undertake to pursue their desired specialization and enhance their skills in the field?
I think the biggest advice that I'd have is to take things slow in the beginning and really identify what it is that you are individually passionate about, and then put your resources there. So commonly people will go after something in the beginning, whether it's a specialty or a certification, and then 4 or 5 years later they're like, I don't know if I really want to do that anymore. So the first thing is make sure that you're really passionate, identify what it is that you're really passionate about, and then dive deep into that section. And if that is a category that involves a specialization, then absolutely it's worth the preparation for the exam, because the preparation is actually where you get the knowledge and I would say skills. You don't get actual skills, but the knowledge and confidence, it's during the preparation, not necessarily the passing. It's during the preparation. And then another piece of advice I'd have is get really, really good at the um, basic, simple things. The people who are, at least that's the approach that I took, and I'm very appreciative that I did that, because now that I have the confidence to do the interventions that I know that the patient needs and put things in place in the way that needs to be put in place, I can aspire to take courses to do the sexier things like the dry needling or the taping or the cupping or the high level educational pieces, because I'm very confident with my ability to do the basics really well.
That's great. That's a great answer. So I told you that that was my last question, but adding on to that question, you told me that most of the learning comes from the preparation course, right? So preparation meaning preparation for the test, but is there any hands-on clinical preparation that you would do while preparing for an OCS exam or any other certification?
No, you don't have to do any hands-on work in order to prepare for the specialization test, but you have to be very familiar with the clinical practice guidelines, and that is what really I feel like elevated my game to a new level. Because, for example, if I'm treating someone with knee pain, if I had just read the knee pain clinical practice guideline, I was very familiar with what works and what doesn't from a research perspective.
Uh,
So I found myself doing things that may not have been as proven in the research, and so I could just kind of take that off the list, put other things in, and not have to think twice about it. And it really lightened my load on my mental capacity, allowed me to be more present with my people, and allowed me to really provide better overall care. So you don't have to practice actual hands-on stuff, but it allows your thinking to be a lot smoother and easier, and therefore you have more brain power.
right, got it. It helps with your problem solving aspect of it, right? When you meet a new client or a patient. All right. Well, thank you so much, Dr. Schneider. It was an honor to talk to you again, and I hope you aspire with what you do in helping patients out there. Thank you.
Well, I appreciate you guys. You guys are doing the hard work, and good luck out there. And obviously, I'm here if you need to contact me as a resource.
So, do you mind sharing your information if ever people would want some more questions, in-depth questions about your specialty?
Yeah, sure.
All right.
You
Thank
can
you.
email me. Juan has my email, but you can email me at GarySchneiderDPT@gmail.com.
And I'll write that down on my presentation. Thank you.